Hey everyone, welcome to the Pillars of Health podcast, where we talk about all the pillars of health and the ways to be healthy. We talk about fitness, feelings, faith, family, finances, all of the things for you to be a well-rounded and happy person. So I'm so excited for today. Today I have my friend, Dr. Michael Schmidt with me. He is actually from around Columbia. He grew up in Centralia. He was a college athlete. He went to did vestibular rehab and childhood development disorders, functional medicine, and functional neurology, which brings him on today. He is a board certified chiropractic neurologist specialist in the Mid-Mo region, and he is going to tell us all about what he does and how cool it is and how it can help you guys out. So, Dr. Schmidt, tell us a little bit about how you got into it and what is functional neurology.
Right. So chiropractic neurology, functional neurology, look at they're the same thing pretty much. The way I got into it is just about every other healthcare practitioner, you kind of fall into it, right?
Right.
So I had a lot of concussion symptoms that I didn't really know were concussion symptoms. I thought they were just normal. And then it kind of it hurt my progress in sports. So then I had to stop my sports, and then I went down the journey of trying to figure out what is going on with me, with my injuries that just kept recurring, sleep issues, light sensitivity, stuff like that. And I fell into someone that did this kind of rehab, and they started teaching me about it. I started doing the rehab and I got better. So I was like, well,
Nice.
looks like I found my cup of tea. I'm going to dive in head first.
Yeah, and you had
And
done so many things before, right? I mean, like wrestling in college they're going to throw everything at you to keep you active.
yeah, I've had a lot of surgeries, but
Yeah.
the things just kept coming at me and it was just over and over again. And
Uh-huh.
finally they were just like, we don't know what to do. And I'm like, well, that's not good because I don't know what to do, you know?
Yeah.
And then you have to figure out a way. You have to keep pushing the envelope. You have to learn. You continue to learn to get better. And that's where a lot of us get our drive, is those kind of situations. So I'm not mad about my past. I kind of
Yeah.
love it because here I am today doing what I love every single day. And it doesn't get any better than this.
Right. Nice. Okay, so tell us about what is functional neurology as far as chiropractic care? How does that play into traditional chiropractic care? And we'll kind of go from there.
Perfect. So when you look at medical neurology compared to chiropractic neurology, first we'll do that one. And we're trained the same way. We have to do the same kind of testing. You have to understand if there is a brain bleed somewhere, if there is a tumor somewhere, if there's a ablative, like bad lesion somewhere, you still need to catch that. You need to be able to find that and then send them where they need to go to get that addressed. All right. The difference, though, is once we find something that is some of that stuff we can't help with, you got to have major surgeries or something like that. But then sometimes there is no structural damage, there is no brain bleed, but the person still doesn't feel right, right? Now we're getting into more functional neurology, chiropractic neurology, where we're looking at not just if there's a lesion somewhere, if there's a tumor somewhere or a bleed, we're looking at the function of a pathway, right? So there's a difference between me being able to reach and grab a cup of water and then me kind of shaking and grabbing the cup of water. So we're looking at the act of somebody doing something with their eyes, their neck, their shoulder, their thoughts. So we're looking at the pathway and how it's functioning, how quick it's firing, how accurate it is. If you're missing a target, that's not normal, right? So we're looking at how well is something functioning versus if there's a complete broken lesion area not working at all, right? So that is pretty much the difference, is we try to find therapies that will rehab that pathway and make it stronger so it works better versus medications or surgeries for those kind of situations.
Nice. So you're
Um,
looking at quality of movement as well. Like,
yeah,
yeah.
yeah, quality of movement, but
Yeah.
also fatigability of movement.
Mhm.
If somebody can do a movement 3 or 4 times with their eyes, but then when you get to 5 and 10, all of a sudden they're fatigued out and they're missing the target, that's a problem too, because you make thousands of eye movements a day. And
Yeah.
if they're not accurate all the time, that's when problems are going to arise for sure.
Yeah. And figuring out why and how they're compensating.
Oh yeah, that's the big tick. Yeah, like you can find the problem, but then if somebody has had an injury for a long period of time, they have compensated, their brain is compensated, and we're really good at compensating. So you have to catch those and then try to repattern it's almost like retraining a motor pattern or a bad habit to get them to do the right thing to overall decrease symptoms and help them improve their quality of life. So that's always the goal.
Right. Nice. So tell me a little bit about what an assessment looks like with you.
Right. So when you look at standard neurological testing, especially with chiropractic neurology, we're going to do a very detailed balance assessment, right? Balance is crazy. I could write a book on balance. I have
Maybe you
wrote
should,
I
honestly.
have wrote actually a few chapters in different books about balance because
Nice.
it's just balance is amazing. It's not just like your ability to stand still. You're like it's your ability to fight gravity, the central
Hmm.
pull from the earth, the center of the earth. Like your ability to do that correctly, accurately, and then without fatiguing quickly. Because I mean, when we're babies, we can't walk. When we get older, we can't walk again, right? So
Hmm.
balance is a big deal, but you have eyes open balance, you have eyes closed balance, you have moving balance, so dynamic balance, you have static balance, you have forwards, backwards, left, right. You got so many balance things that you can test on somebody. And one of them are some of them that can be really good at, and then some of them it's just like they're like, why can't I do this? And I'm like,
Hmm.
I don't know, probably your head injury. Let's fix it. And then
Hmm.
we start piling on therapies that they can do that seem very subtle that end up making a big difference for them. Um, the next type of testing we do is called vestibular testing
Hmm.
and eye movements. So we're looking at how well and accurate can somebody move their neck left and right. If we put them in darkness with these goggles and have them just kind of look straight ahead, that's a very good indication if there's a vestibular imbalance between left, right, or up and down. And we can kind of localize different areas or canals and provide therapy to change those. So we're looking at the inner ear balance system. We're looking at your ability to use your eyes correctly and accurately. But then we also go through those standard musculoskeletal, right? Can you use your shoulders correctly? Can you use your neck correctly? Can you activate your core the right way? Are you breathing? Oh my gosh, we have forgotten how to breathe for
Oh, you mean
some
it's not just
reason.
like this?
Yeah, we're all shoulder breathing. We all have high levels of stress, which
Uh-huh.
therefore we're going to start shoulder breathing just from that. But, and then leg movements and feet movements, we're checking all those. And to me, it's all about, can you move that body part by itself? Or are you recruiting other things? I see all the time, I'll test the hand, but then you also see the jaw going like,
Hmm.
that's not normal. That's recruitment. You should be able to use one body part at a time. How quick and accurate are they with that body part? Are they smooth and fluid with the body part? And all of those are really checking different
Oh, I think I
about
lost you for a
them
second.
and seeing how they're working, right? By body part basis and kind of move from there.
Nice. So you have this super thorough assessment. You're looking at so it looks like some reflexes and all of that stuff. And then are you adjusting? Are you just giving exercises? What does that look like afterwards?
Yeah, so it is all based off of the patient and the
Mhm.
exam, right?
Okay.
So we're also hitting those primitive reflexes milestones that should have been developed, and you'd be surprised how many humans have those, especially adults. As we
Mhm.
get older, we tend to get those as well. But whenever we're looking at therapies and treatments, if it has to do with somebody's neck, like you have a joint that's locked down due to a muscle that's has an increased tone, that can affect your vestibular system, that can affect your eye movements, that can affect your ability to use your shoulder. So a chiropractic manipulation would be very indicated in that. Sometimes it's the eye muscle is weak, right? So we'll do eye exercises to really get that eye muscle stronger, and that improves their symptoms. Sometimes we're doing traditional vestibular therapy where we're having them stare at a dot, turn your head in specific directions to rehab that area. And then even sometimes we're doing like shoulder isometrics on one side or the other. So based off of the exam of what we find they can't do appropriately, that is where we add in the therapy. And it could be a combination of multiple things. It could be just one thing that they need. In the end, it's like, to me, it's whatever gets the person better. Like that's all. Like, and the more tools I can get, like the better, because then I have more avenues to help somebody get better, and have a better quality of life.
I love it. So you run someone through all this, you give them a home exercise program, you come in, you reassess, and then you are rewiring the brain in so many ways, because, like, even if someone says they haven't had a concussion, sometimes birth is the most traumatic thing someone goes through. Birth is traumatic for everybody. So do you find that they need to come in, like once a year? Do you like to kind of follow up with people? What kind of ongoing stuff do you like to do?
So I find myself doing a couple different things, and I keep changing like every few months about kind of what I deem is like necessary. So typically, if somebody comes in and they have had a concussion, right, and it's been recent, I can give them the therapies off of the exam, and they can do very well within a couple of weeks. I may reassess in a couple of weeks and be like, all right, perfect. You fix these findings. You're ready to go. Start pushing the limits, start exercising again, start lifting, start doing all these things. And then just go do if you have another concussion, whiplash injury, or an accident, or you feel anything, just hit me up. We're going to be able to test again and see what happened. I find myself more and more saying, why didn't you come in sooner? Right. Because we like to fight through things, and I am almost worse than anybody at it. But if I can catch it sooner, I can fix it sooner. You don't compensate it as hard. Bad habit, bad motor pattern is not as bad as it was. So now I'm like, man, well, it would be bad to have a decent checkup, because way I look at it is, if you're trying to be like healthy and want to have like health span, like a good health span, longevity, you should have a really good baseline of your neurological system and how it's functioning. You should have a really good baseline of your metabolic system, right? With blood work, mineral, vitamin testing. You got to have these, or like rehab, to make. You have to have those as your fuel source in order for me to even do my. So a lot of times I catch myself saying, are you hydrated? Are you sleeping? Are you eating well? Are you getting nutrients and vitamins? Because if you're not, you can't activate a brain that's not being fed correctly, and it's not hydrated. You just can't do it. And so we got to make sure all that stuff's working right. So it's not just one thing or the other. You got to make sure your mental aptitude's intact. You have a good drive, a healthy drive for life. You don't have any adverse childhood experiences, because those can hold you back. You gotta hit all the avenues of it, and I'm just one of those. So I like to open the window to everybody that I see about all those other avenues, and make sure that they understand I am just one. I am the neuro side of it, the motor sensory side of it, and we're good at working with those. I can give you ideas of who to go to see for these other things, like metabolics, infection testing, EMDR, or any other kind of emotional processing stuff. Like, they need to be aware of these things. So I really try to bring awareness to the table that I'm not just the one thing, right? It involves a team. There's a team of people, and I'm not good at those other things. So it's important to be humble and aware that there's so many other things that can be involved. So that's where, if I'm doing a test, if I'm doing the exam on somebody and the exam looks pretty good on mine, I go, okay, here's the deal. You might have something metabolic going on. You might have an infection, right? We should definitely, I'll give you recommendations of people to go see, but you need to get this fixed, right? This is not your problem. I can't help you, but I know somebody who probably can. See ya, Keep me posted, though. I want to hear about it. I'm interested in those things for sure. So I went on a little bit of a rant there.
Oh, I'm happy about it. You touched on so many things I was going to ask you anyway about, because, our body shoves trauma in different spots, and so much emotional trauma comes out when you're doing, some of this brain reprogramming, all of that. You had a concussion when you were 6. There's going to be some emotional things about being 6 that are going to come up, or some things in school that you had difficulty. Something I do want to touch on, because of your history in athletics, and treating so much with inflammation, where are you at generally with dietary recommendations? Because there are going to be some people that are like, no, I'm just coming to you. Tell me what to eat. What is your typical, low inflammation? What is your go-to dietary recommendations?
So I'll go off of like classic concussion research has shown that if you have a higher sugar diet, you can literally reconcuss yourself, right? Sugar is inflammation. Inflammation is sugar. Now, it's not that sugar is bad, right? It's just that it is inflammation. So you need to be aware of that process. If you already have a concussion, you have a lot of inflammation, not just in your brain, but in your gut. They're the same barrier. You disrupt one, you disrupt the other. If you eat bad, right, you're disrupting your brain barrier. If you have a concussion, you disrupted not just your brain barrier, you're disrupting your gut barrier. And they've shown this in the research over and over again. So classically, if somebody has recently had a concussion, I immediately say, hey, you got to eat really strict, right? Veggies, meats, proteins, get your healthy fats in. We want to be very careful with not cussing yourself so that you can just heal faster, dietary recommendations overall, I'm like, hey, just get your veggies in, please, right? Your nutrients, your vitamins, and your minerals, they are in your veggies, your meats, healthy meats, healthy fats. Like you have got to get those in. Empty calories are all around us, and they are absolutely useless unless you're getting ready to run a marathon or fight somebody. They're immediate energy, or they get stored for fat. So we have to get copious amounts of minerals and vitamins inside of us to make things work right. That's to making neurotransmitters, making hormones. All of those require vitamins and minerals, and we are in a severe lack. And our ratios of electrolytes are all off. Like everything is of that nature is low. So the more of that we can get, the better off we'll be. We can remove heavy metals. We can beat infections. All these other awesome things if those vitamins and minerals are right.
Yeah, I think we run into that a lot because so many people, they want to do like these fad diets or they're on, certain meds like statins, or they're on low sodium or all that stuff, but our brain needs cholesterol. And, if you're on a low salt diet, but you're eating a lot of fast food, you're not on a low salt diet. And so we talk a lot about like, what's the difference of table salt versus Celtic salt? Celtic salt has 82 minerals in it. Or if you're a vegan, you're not getting those amino acids that you absolutely need. So I think it's, trendy.
That's exactly right. Everybody wants a trend to jump on, but that's not necessarily the case. And everybody's different depending on their scenario and what infection they may have inside of them, at what they should and could eat. So there's like, if somebody has a fungal infection, eating yeasty products is it's going to hurt you, so like it's going to give you symptoms. Golden rule, if I say, if you eat something and you get a symptom from it, you probably ought not eat it for a little bit and figure out why you can't have it. If you're getting heartburn from something, your body's telling you something, just please listen. That's the thing. Just listen to your body and see, and then figure out why. Like, why did I get heartburn when I ate this? Like, that doesn't make sense. Do I have an H. pylori infection? Like, what's going on in here?
Yeah. Why are you taking Tums every day?
Yeah. You shouldn't do that. Listen to your body. It's a very magnificent thing. But and then we're always, as practitioners around it, help you solve your problem, help you solve your puzzle. It's an ever learning process. And I love educating on that and giving people like stuff to look up and learn about. It's important to understand and learn about your own body and health and how it works and what you can do, instead of being a victim of your health. That's not a good way to live about it.
Yeah. And I feel like a lot of my people who've had concussion, which we probably need to talk about what a concussion is, because a lot of people don't realize that they've had a concussion. They're like, oh, I was never knocked out. Well, that's not necessarily what's required to have a concussion. But before we get to that, I was going to say a lot of people who have had any sort of head injury or body injury tend to dissociate. And so, that's the kind of population to where they've lived with pain or they've lived with dysfunction for so long that they don't know what feeling good feels like. And then when you start doing some diet cleanup or some neural reprogramming, sometimes you feel kind of bad or it's kind of difficult, but it's worth it in the end, right? Do you find that people at first are like, wait, I feel kind of terrible. Like, well, okay, but there's an end game here.
Absolutely. And I've been there. So I was one of those that was unaware of how good you should feel. The way I try to explain it is, if you don't wake up every single day of your life filled with energy and drive for something you're doing, something is wrong. I promise you, something is wrong, and you should have that. It's a great feeling, and I want everyone to have it. So that's kind of my baseline, is like, if you're not waking up ready to kick some butt and like
Yeah.
enjoy life to the fullest, something's wrong. Like, whether it's your sleep, or you did have a bad concussion or an injury, or your mental status isn't working right. And you just need to talk to somebody. That needs to be figured out, because life is amazing and it's way too short. It's way too short, and it goes way too fast.
Oh
Way
my
too
gosh.
fast.
Yeah, for sure. So let's talk a little bit about concussions. So when you have a concussion, obviously most people traditionally think of, oh, I hit my head and my brain got bumped. But sometimes you can have a torsional concussion, right? Like in the dura, that can kind of, the brain has some movement in there. So tell us a little bit about what are common symptoms of a concussion, even a mild one.
So I got some props here, so that might help.
Yeah.
But when we're looking at concussions, right? Everybody, well, not we're getting better at it, but most people think that in order for you to have a concussion, you have to black out, you have to be knocked out, right? That is absolutely wrong. And the worst than like getting knocked out one time is having repetitive low blow subclinical hits, whiplashes, or joggles to your head and brain that end up compiling over time, right? So that's the big deal. And when you're having a concussion, you don't have to just hit your head. If you get a sudden whip to your head, like a whiplash injury or anything like that, you can't separate a whiplash injury from a concussion. They are one of the same, because you got this little bitty neck bone, and you got this big old noggin sitting on top of there. If you jar this too quickly, this guy's going to get after it too. And most of the time, you're going to get some rotational forces in there. You're going to get stretching and shearing of those wires that connect the pathways from your brain to your body, or in your brainstem, that are controlled of breathing and heart rate and blood pressure and those kind of things. Yeah, you got to think of your brain as the consistency of like a little bit more than Jello. Right. So if you're getting your head sloshed around, you better believe it's banging against your skull forwards and backwards, side to side. And then that area where your brain meets your right there in your spinal cord, that is the area that's most damaged, because that is right there in your brainstem. And that's where most of the action is going to take place, with the forwards and backwards and side to side motion. So that's where people get issues with heart rate, blood pressure, respiratory issues, like they feel out of breath, dyspnea, like all these things that will happen just from a whiplash injury, or you got jolted. You didn't even have to hit your head, and these kind of symptoms can arise for sure.
Yeah. So this is like if you've ever played Red Rover, or if you've ever like fallen off a swing or a hay bale, or been knocked off your butt by your dog. I mean, like this happens a lot. Or I mean, any car accident ever. I mean, the seatbelt's going to hold you and you're going to pop back. Any of the, I mean, so it's like almost everyone has probably had some version of concussion.
Oh, absolutely. Ever since the seatbelt came about, there's less mortalities, but there's way more neck whiplash injuries and concussions and stuff like that. So it's a good and a bad thing, but we need to understand, if you're not getting a little bit of a concussion, you're not living, right? Kids do it all the time. You see them fall down, knock their head, that's part of living. It's part of growing. But if you don't accidentally rehab those pathways by being physically active, or just playing games, playing outside, you're not going to accidentally rehab those pathways unless you're doing those kind of things. You can accidentally rehab those pathways. Sometimes you can't, so if symptoms stay, that's when you need to find somebody that can help you out.
Nice. So tell us some success stories that you've had. Like, obviously it's not just like headaches and pain. What are some cool things that you've seen? Because you've been practicing for a while. You've seen, I'm sure some things where you're like, oh, that was actually really awesome.
I'm starting to get a pretty strong liking to, and probably because I keep seeing more and more of them, is like dysautonomias, or like POTS, heart rate, blood pressure issues, and seizures. Those I've been seeing a lot more of, and to me, I guess I like them more because they're kind of tough. They're tough to get the person the help they need, but also because a lot of times they're so multifactorial that you got to make sure you got to figure out the metabolic side. You got to make sure they're sleeping right. You got to make sure that they're eating right. You got to make sure that they're pushing the limits with their exercises to get all that stuff working the right way. But to me, those are becoming more and more intriguing to me, as I'm getting better and better at learning all the different variations of those. People think that if somebody has seizures, they're all coming from the same area. That is absolutely wrong. I don't think I've had one that's been the same type of treatment yet. And that the same goes with those POTS and dysautonomias. Is they're all so different, and that's where the humanism comes in, is that we are very, very different from one another, and what makes you tick is way different than what makes me tick. So finding somebody's drive and motivation to do the rehab, and then find the pathways that have been hurt to get those going, is that's a fun challenge, and it's very rewarding when you nail it, for sure.
That's awesome. That makes me think of a lot of people to talk to you about, because POTS is so common with Ehlers-Danlos, which is joint hypermobility syndrome, for anyone listening who doesn't know. And I don't know if Ehlers-Danlos is just popular right now, but I feel like it's getting diagnosed more. There are a lot of people in Midmo with EDS, and there's always a dietary component. There's always some food allergy components with it. It's tough to treat, but then you get the POTS, and then you get sensitivity to cold or sensitivity to heat, and that's not something I would have necessarily thought of for chiropractic care in general. You know what I mean? But with the functional neurology, it totally makes sense, because you think about your joints are lax anyway. And so, you've got this heavy head sitting on lax joints, holding your head up. That's cool to think about.
Yeah, with those, it definitely goes to a lot of adding more stability, because if you have ligament laxity, that's collagen, and it's not just your ligaments of your joints, it's your vessels of your body, so they're going to be a little bit bigger than they should. So you're not constricting enough, so you're not able to put blood where it needs to go. And that may be a little bit of genetic susceptibility, but like, you have epigenetics, so it's one of those, like, can I decrease it? Can I turn it off? Can I do stuff to make it better? Those the collagen and the ligaments, they need certain minerals and vitamins to make them work the right way, and if you have an infection or an imbalance, or you're not doing the appropriate thing to get those absorbed, you're going to have a problem, so that needs to be addressed. So yeah, absolutely, if metabolic is involved, metabolics involved, hormones are even involved sometimes. There's so many different factors that are involved with those kind of cases, and that's why I enjoy them. And I enjoy helping the person figure out how to be in control of that situation, so that they have a better quality of life for now on.
Yeah. So let's talk for a second about how your body can kind of perceive, like, even without a physical trauma, do you find that emotional trauma causes concussion-like symptoms in people? Because I know you say you work with, like, people that do EMDR. So I'm just thinking, with eye movements, do you ever find that people are storing emotional things, but it does actually show up as, like, abnormal reflexes or abnormal eye movements?
Absolutely. So I'm glad you brought that up, because there's been numerous times where I will do the exam, we'll find a specific finding. It could be a nystagmus. It could be that they just can't use one of their arms appropriately, or they can't hit the target on the left side of their body with their eyes. They keep missing it. And we do the therapy that I know will fix it typically, right? And I'll give it to them for a week or two, and then they'll come back. When I re-examine, if that is not better, I'm already questioning, like, okay, what else is involved? Like, there's something else involved. And I've had numerous times where I send somebody to an EMDR therapist or an NET or any of those of the above, and they go there for a couple sessions. They come back just to recheck the findings, and it's gone, or like 90% better. I'm like, this is what you need. You don't need me. You need this. Do what I gave you, yes, but like, go and get all that rest of that addressed. So like, I see it over and over again. So these kind of things will come out, and I will see it, and I'll be like, okay, we're going to do the therapy that's supposed to fix it. If it doesn't fix it, like you got something holding you back. It could be an emotion, it could be a trauma from your past. You need to get that addressed, or you're just not going to get where you need to be, right? So my therapy will only take you so far, but if that gets addressed, then it's just going to be like you're done, you know.
Yeah.
So yeah, absolutely. And I see a lot of that is involved. For sure. I think it's like 80 to 90% of the pathways in your brain are actually like commissural pathways or association pathways, which have nothing to do with your sensory motor system. It all has to do with like your behaviors, your thoughts, and your responses in situations. So that's like, to me, that's mind-boggling, because I know there's a lot to say about your past history, your belief system, and your motivation, your drive, and what drives you. You know, there's a lot going on there that I think we just need to learn more about, for sure.
Yeah. Oh, I think it's so awesome. The brain is so amazing. Like what our bodies can deal with is so amazing. Sometimes frustrating, because our bodies will deal with so much before they're like, okay, I'm done. Which from a manual therapist standpoint, I'm like, well, I wish your body would have like made it obvious before we have to do all this stuff. But we would not be functional human beings if our body shut down every time something was wrong. So it is cool to think that you can rewire your brain, which is essentially, I mean, that's what you're helping people do all the time.
Oh, absolutely. It's just like learning a new skill, learning a new game, learning anything. I mean, that is neuroplasticity at its finest. It takes repetitions of a very specific, focused intent, and you can do it. But you got to have the nutrition behind it, so you can get that going. You got to be able to sleep correctly and deeply in order for the recovery process. Like there's like all of those are involved. You cannot just do one, and so it's a
You
fun
can't just
thing.
be on like TikTok at 3 o'clock in the morning and want to feel better.
Oh yeah, just shut your melatonin down. That's fun, right?
It's just be like, I need the dopamine. I need the dopamine. That's
Yeah,
funny.
yeah.
Okay, well, I think we're going to wrap it up. We're almost out of time. Dr. Schmidt, thank you so much for coming on. If you guys have any questions, shoot me an email at christy@libertaspt.com. In the show notes, I'm going to put where you can find him in case you have any questions for him. He has been such an asset to me on asking about tricky patients, and it's so fun to have people in mid-mo to share people with. So thanks again for listening to the podcast, and we will